Hello. Is that working? Yeah, all right, perfect. I was most nervous about the microphone, not going to lie. So welcome, everyone, to our co-sponsored event, Hudson Hospital's Programs for Change, Hazelden, Betty Ford, and Make It Okay. My name is Brian Bartlett. I'm the manager of Hudson Hospital and Clinic's Programs for Change, as well as Westfield's Hospital's Programs for Change. Glad you all could be here tonight. It's like 70 degrees outside, so I'm really glad that you're here. That's me. Hudson Hospital Programs for Change has been around for almost 40 years here in the St. Croix Valley. In 2013 or so, we started offering services at Westfield's Hospital in New Richmond, and about 7 or 8 years ago, we opened up Amory Hospital's Programs for Change. But we are not the only service that is here in the St. Croix Valley. We're happy to welcome Hazelden and Betty Ford to the Valley. They are very well known, and we're super excited to have them here. They are joining other programs in the area, including Berkwood. There's one Berkwood up there. Woo! Yeah. So everybody divide into your camps here, and I hope you all brought your water balloons because we're going to be having a fight here shortly. Berkwood Residential and IOP Services, Arbor Place, which is located in Menominee, which is residential services, the St. Croix County Human Services, Puce County and Polk County Human Services. The local, we got a human services person here, all right. Yay. And then our local Alano clubs, not just 12-step do we have for peer support, there's also Celebrate Recovery, which is an exclusively Christian-based program. So we got lots of resources, but we are certainly happy to welcome Hazelden. And Kinnick Falls. I cannot forget Kinnick Falls. I apologize. I will lash myself after we're done, I promise. Kinnick Falls, yes. So we're happy to have all of us trying to deal with this disease that is addiction. I'm going to talk about the thing I know best, which is Programs for Change. We are an intensive outpatient program. Like I said, that's been around for about 4 years. We started a long time ago as a little 10-bed residential program. And about 25-ish, 30 years ago, switched to intensive outpatient. That's what we've been ever since. When people come to our program, they spend a lot of time with us, hence the intensive name. We spend about 9 hours a week with people for 2 months, and then they step down to once a week for another 5 months. So we get to know our clients really well, and when people come to us for an initial appointment, and I say, boy, you should come to treatment, and you shouldn't drink so much, or at all, and they say, well, how long? I say, about 7 months. I say, that's so long. I say, well, you're not going to want to leave when you're done. And I'm right, turns out. We do get to know people a lot. You can see all the services that we offer. That is the waiting room of our Hudson location. We're located right inside the hospital, right across from the cafeteria, so it works out perfect for people on break. In addition to the intensive outpatient, that one-time week program that I mentioned is called Continuing Care. We offer initial assessments that include a full psychosocial history, DSM diagnosis, and then the standard 4 level of treatment recommendations, which is ASAM. So all of that happens in 2 hours or so, and then we make recommendations to all of the people who are here with us tonight, including our program. So that's us. I am really excited to get to the main event, which is my boss, my friend, Pete VanDusartz, who's the director of Behavioral Health for St. Croix Valley. So let's welcome him to the stage.
Thanks, Brian. Okay, is this on? Yes. All right. Hi, my name is Pete, and I'm an alcoholic. I've been giving talks like this to groups of people for many, many years. And those who are here from Programs for Change know that my usual talk is 3 hours on Wednesday nights. That's what I did last night. And they told me I got 40 minutes. I'm going to ram some stuff in tonight. I'm going to crunch it. Got a lot that I want to say. I'm kind of psyched up about this. My kids have been hearing me talk about doing lectures for years. I used to come home from work and tell them, there are people who actually pay me to lecture them. So they're here tonight. I have 3 of my kids here tonight. My dad's here tonight. And so I'm really psyched up for this talk. I've got a bunch of stuff I want to say, and some of it's going to go really fast. It's being recorded, I think, so there'll be a YouTube video. You can slow it down if you want later. But what I want to start with is talking about my introduction. My name is Pete. I'm an alcoholic, and what does that mean? I want you to think about what that means to you now. I know there's a lot of people here in recovery, a lot of people in the field, some other leaders from the community. We all know from our society, from pop culture, that's a classic introduction at an AA meeting. There's lots of reactions to that. What I want to say about that is, by the end of the talk tonight, I want to be as clear as possible about what I mean when I say that. Because my feeling is that us alcoholics get a bad rap in society. There's a lot of stigma about what it means to be an addict, what it means to be an alcoholic, what it means to be in recovery. And I'm going to start with talking about the problem, but most of tonight is going to be positive. I'm going to end on a very high note. This is a night of celebration. I'm here to celebrate all of you, especially people in recovery, because that is deserving. But to get started, we're going to talk about the problem. This is a public health measure map about excessive drinking in the United States of America as measured by county. These are very carefully studied numbers. Every county in the United States represented here. This map has looked like this for decades, at least 4 or 5 decades, with Wisconsin having the biggest problem of excessive drinking in the country. But there have been a lot of these kinds of events over the years. About 12 years ago, we had an event called Heroin in Hudson. I spoke at that event as well. That event was put on by some people who were very importantly well-meaning to say, we need to do something about this tragedy. About 12 years ago, we had at least 8 young people die in this community from overdose from heroin, and it was terrifying. It was scaring parents, it's scaring people at the schools, and they pushed back. But I've been around long enough to know that was just one of the phases that this community has gone through. Prior to that was what I call methamphetamine phase 1. Methamphetamine phase 1 was all of the meth labs. And methamphetamine's been around forever. It's been around a long time. But at that time, it changed. And it changed because of the internet and people figuring out how to make meth and how to find this stuff in Sudafed. And then we had meth labs, and then it got a reputation right here in River City as being a safe drug and a non-addicting drug. That's the reputation it had. The bad drugs were the city drugs, heroin and crack and cocaine. The safe drug was meth at that time. It'll help you get your apartment clean and help you with your hangover. And you buy it at the back of the bar in small towns, which was, of course, not true, and it was devastating. And not only devastating to the people who were addicted, but devastating and to their brains, but devastating to our public health departments, because when the meth labs were found, they were a toxic waste site, and it broke the budget of the public health departments of these counties with one meth lab, and next week they find another. Then came the opiates. And the opiates came, we moved away from meth, moved to the opiates, because we had rivers and rivers of prescribed medication in the medicine cabinets. And at one point, the young people in these communities were partying more with pill parties than they were with marijuana or beer. And then the pills started to dry up. We started to push back, and we had warnings about that, changed some laws, things like that. And people started to crush up their oxys and their Percocets. And when then they got more scarce, then they switched to heroin. Started snorting heroin. Build up a tolerance. Stop using for a while, get in trouble, Tolerance drops off the table, use half as much as they used to and overdose and die. Heroin in Hudson. And we had this big event to try to educate people and to change that, and it made a difference. And then came methamphetamine phase 2. And these are the super labs and intravenous use. And one of the key features of methamphetamine phase 2 is psychosis. And that is brain damage, and we ended up having lots of people end up in our psychiatric units with hallucinations and delusions after the drug wore off. Trust me, my talk is really positive, okay? You're gonna get there, okay? And now, of course, we have methamphetamine with fentanyl. People overdosing with fentanyl. But this bugger has been around forever, and that is alcohol. Now, I want to be clear about something. We're sitting here in Hudson, Wisconsin, beautiful community on the river with these beautiful clubs and bars and taverns and restaurants. I'm not an abolitionist. I'm not here to talk bad about alcohol. I'm not here to talk bad about drinking. The problem is excessive drinking. So I want to get to that. I want to be clear about what that means. This study, this is a public health study. We'll break it down to the state now, state of Wisconsin. And as you can see, St. Croix County, right at the top of the list within the state. So if the state's at the top of the list for the United States, St. Croix County is at the top of the list within that state. And here's the St. Croix County. This measures excessive drinking, which is binge drinking and heavy drinking. Binge drinking is defined by having 5 or more drinks in a setting. For a man, 4 or more drinks at a setting for a woman. Okay? And so, very careful measures about this, and look at the cost. So, heroin in Hudson, 8 people die in 12 months. Alcohol, 23 a year, every year. All right? This is the reality of our substance use problems. But again, the problem is not alcohol. The problem is not even drinking alcohol. And the problem is not the bars and the liquor stores. Those people out there that drink 1.5 beers, I don't understand, but that's fine, okay? That's fine. So excessive drinking comes from dependence, and that's what I want to teach a little bit. I'm going to rock and roll through teaching this stuff. I've been teaching it in front of groups for 20 years. I'm going to go through this quickly. But you have to understand the nature of the problem. Excessive use comes from substance dependence. So substance dependence occurs when a person takes a substance from outside the body and gets it inside the bloodstream. There are 3 broad categories: central nervous system stimulants like methamphetamine and cocaine, central nervous system depressants like alcohol and all the opiates and the benzodiazepines, and central nervous system hallucinogens like all the psychedelics, a lot of the designer drugs, and marijuana. 3 broad categories about the way they impact the brain. First thing you gotta do is get it into your bloodstream. You can either eat it or drink it, and it's absorbed through your stomach lining into your bloodstream, or you can inhale it or snort it. It gets absorbed through your lungs into your bloodstream, or through your mucous membranes directly into your bloodstream, or you can push it through your skin and put it in your bloodstream directly. All of these substances have a few things in common, and one of them is once they're in your bloodstream, they will cross the blood-brain barrier and go into your nervous system. Not everything in your bloodstream will do that. Do we got any doctors here tonight? Okay. Fact check me. Fact check me. Fact check me all the way along, okay? So they cross the blood-brain barrier, and they do a lot of different things to the different parts of your brain and how your brain functions. I don't care about most of those. They impair short-term memory. They impair your coordination, okay, your reaction time. all those kinds of things. What we care about is how they impact the part of your brain that has to do with core moods and emotions, how they make you feel. Do they make that part of your brain that controls core moods and emotions, does it powerfully shift that, make you feel very different, like a beer buzz, or getting stoned, or the mood-altering effect of your opiate pain medication? I can deal with hecklers, don't worry. And the key here are the core moods and emotions. That means your sense of well-being, your sense of, do you like yourself? Your sense of, how is your life going? Your sense of self-esteem. Your sense of anxiety and worry and depression. Your sense of past emotional pain from trauma and loss and grief. These are the core moods and emotions. And if that substance gets into your brain, shifts your mood and emotion, and that's powerfully reinforcing, you might be likely to do it again. It's not a problem yet. But if you're likely to do it again, it may become a habit. Alcohol, marijuana, legal, not legal. In my camp, they're all the same. They affect the part of the brain that make you feel different, and it's reinforcing. Now, the thing about the reinforcement is, you would think that if you take a substance and it makes you feel different and you like how that feels, that's reinforcing. It's not the main issue. The main issue is, do you have a pre-existing mood or emotion that you don't like anxiety, and then you drink? And alcohol will lower anxiety. Or if you have low self-esteem and you take an opiate and you feel empowered. Even boredom. And you smoke marijuana and you don't feel bored anymore. These are powerfully reinforcing. I've had people tell me when their drug hits, whether it's alcohol or opiates or marijuana, when their drug hits, that's when they feel like their real self. And that is powerfully reinforcing. When all of a sudden, there I am. Still not a problem. Because the problem only comes if you repeat it. And you repeat it, and you repeat it, and repeat it. And over time, it creeps up on the list of priorities. Till eventually, it crosses the first threshold. And the first threshold is, today I will drink or use even though it doesn't make logical sense to do so. Like I don't have enough time, can't really afford it, behind on my phone bill, but I do it anyway. So I crossed the first threshold. Choosing to drink or use, contradiction to common sense and logic. And then I repeat that. And I do that again, and again, and again, and again, and again. And then I cross the next threshold. And the next threshold is, today I will drink or use even though I have to violate my own personal values to do so. Not society's values, not my family's values, not the church's values, my values. In other words, I believe in having a relationship with my partner, and it's you and me against the world, and I want to be honest with you, but I'll lie right to your eyes in order to drink or use today. I'm violating my own values in order to drink or use today. And then I repeat that. And I do that again, and again, and again, and again. And then I cross the third threshold. And the third threshold is, now my substance use is causing serious consequences in different life areas. Relationship problems, problems at work and with productivity, problems with my time management, financial struggles, and then even more serious consequences, like legal consequences or harming parts of my body. But I keep drinking or using anyway. We add those together, those three thresholds, and that adds up to compulsion. It takes time and repetition. The thing about the brain is that we build habits and we build behaviors and we strengthen those by repetition, practice, over and over and over again. And what happens inside of our brain is we build a neural pathway. That's how we learn to walk. That's how we learn to talk. That's how you learn to play guitar. That's how you learn to shoot a basketball. is you line up, okay? You line up and reinforce the neural pathway in your brain for that behavior. And that's true for addiction as well. What that means is you grow, build, and reinforce a neural pathway in your brain related to the pre-existing mood and emotion you don't like, the use of the substance, flooding that part of the brain, the relief of that, and now you've got a neural pathway for that substance use and mood altering. It's not really an issue until you repeat it over and over and over again, but because what happens is you reinforce that pathway till you build what I call the gnarly root. The gnarly root is that neural pathway in your brain that you've reinforced. You know, how many times did you practice playing trumpet? Not enough. I got kicked out. How many times did you practice shooting basketball? How many times, right? How many times did you practice shifting mood and emotion with a chemical? Whether it's alcohol or marijuana. How many times did you practice that? Some of us every single day. Till you're expelled from Hill Murray. And so it is the power of that neural pathway that's been reinforced that is the problem. But here's the thing. It's not a moral issue. And it's not a character issue. And it's not an issue of intelligence. It's a physiological reality in your brain. It's causing compulsion. That's why shame won't be helpful. Right? Calling people stupid won't be helpful. Tell people to get their shit together won't be helpful. It's a physiological reality in their nervous system that causes addiction. You see, everybody in here, everybody in the world has a bucket of dopamine on their shoulders. These are the neurotransmitters. I'm simplifying, okay? There's, go with the bucket, that's a good, bucket of dopamine. Dopamine is the neurotransmitter most powerful for those mood and emotion shift and reward and pleasure, okay? Dopamine. So what you do when you put this stuff in your bloodstream, it goes to the blood-brain barrier and hits that, what it does is it purges dopamine. Boom. Or it prevents the reuptake of dopamine into the nerve cell, which means it keeps it sitting there like a pinball. Okay? That's what chemicals do. But here's the secret. You're not getting drunk from the alcohol. You're not getting high from the drug. You're getting drunk and high from the dopamine. You're just artificially manipulating it with a chemical. Okay? So what's the solution? Oops, we'll get to that. The solution is to turn off the gnarly root first. What does that mean? Abstinence. Stop it. But that's just the first part. Abstinence is not recovery. I'll say it again. Abstinence is not recovery. You could stop drinking and using, never drink and use again. It's not recovery. Because what are you left with if you stop putting the substance in your brain? You're left with those original uncomfortable moods and emotions. The anxiety, the low self-esteem, the insecurity, the pain from past trauma. And now you're not using a chemical to artificially manipulate dopamine anymore. So you're left with struggling. So what is recovery? Recovery is finding new, healthy, positive, effective ways to deal with mood and emotion that work and they're non-chemical. But not only that, you have to replace the gnarly root with new neural pathways. And that doesn't mean just learn how to do it. And that doesn't mean just learn how to do it and prove you can. It means learn how to do it, prove you can, and repeat it. And practice it over and over and over again until your new neural pathway for dealing with anxiety is effective. In fact, so effective, you have now built a neural pathway to deal with anxiety that has nothing to do with chemicals, but has to do with behaviors. counseling, therapy, meditation, strategies. And you have new neural pathways to deal with boredom, and you have new neural pathways to lower your social anxiety so you can be social. On and on and on. So you replace the gnarly root with a whole new crop, a bunch of neural pathways to learn how to heal and learn how to live your best life. Brian, where am I at with time?
About 20 minutes.
Okay. But none of that is what I'm here to talk to you about tonight. At Programs for Change, we help you turn off the gnarly root, teach you strategies about how to build new neural pathways to deal with mood and emotions in healthy, positive, effective ways, and how to practice them within your daily life and get better and better and better at them while you're shoveling snow, changing diapers, and paying taxes. That's the idea of intensive outpatient primary treatment. Okay? That's the model that we have. That's what we've been doing here. So if we know how to do that, why are there so many people, you remember the map? Why are there so many people still involved in the substance use and addiction and not coming to treatment and figuring out how to do this and get better? It's because of stigma. Like I said, us addicts get a bad rap, okay? People don't want to admit they got a problem. They don't want to admit that they need to change this. There's too much stigma attached. Now, I've been part of Make It Okay for, 12 years, something like that, right, Stephanie? And so Make It Okay is an organization to reduce stigma about mental illness. When we started Make It Okay through HealthPartners, we identified that we have successful, effective treatments for mental illness, but people not getting them. And people are dying anyway. And we tried to figure out why, and we found out it's because of stigma. Nobody wants to admit they have a problem. Nobody wants to admit they need therapy or meds or go to the hospital, so they avoid treatment. Do you know what happens if you have a chronic, life-threatening disease that you put off seeking treatment for anywhere from 10 to 25 years? You die. If you have Crohn's disease and you refuse to get treatment for it for 12 years, you may die before you get the treatment. If you have heart disease, if you have diabetes, etc. If you have a mental illness like clinical depression, but you avoid treatment, you refuse to go to the doctor, try to get help, then you may die. The idea of lowering stigma is change the way we talk about it, take it out of the silence, so that people can deal with it and address it. So that's Make It Okay. We got a whole booth out there. There's a whole bunch of stuff. Go to the Make It Okay website, learn how to lower stigma about mental illness. Then a couple years ago, we added stigma about addiction. Turns out, and these are different kinds of stigma: public, personal, courtesy stigma, too polite to talk to people about it, that kind of thing. And, of course, structural stigma, which is our laws, our school systems, correctional facilities, things like that. Turns out stigma about addiction is worse than stigma about mental illness. Why? Why is stigma about addiction even worse than stigma about mental illness? You think I'll just give you the answer, right? Because people think you've done it to yourself. That's why. You brought it on yourself. You should just change the way you're living and things will be fine. They don't know about the gnarly root. They don't know how powerful that compulsion is once you've changed your brain and reinforced it. So we have to overcome stigma so that we can get people to receive the treatment that we know is effective and is helpful. I'm sorting through my stories. I have lots of stories for you and no time to tell them. I'll tell you one story. Well, I'll just say this really quick. if your friend's 21-year-old son gets in a car accident and ends up in the emergency department at 3 in the morning, the text messages start, the phone messages start, and we start to rally around. They're really hurt, they're getting an MRI, they're going to need surgery, they're unconscious, there might be a head injury. You know what happens in the community? Everybody stands up. Everybody steps forward. What do I do? Do you need a car brought somewhere? Do you need somebody to watch a kid? Where's the dog? Right? And we do a caring bridge site. Everybody stands up and rallies. And if that kid ends up having a head injury, we might have bracelets at the high school, the whole deal. But what if your friend's 21-year-old son is in the ER because of a psychotic episode? You don't get the text. His family's too embarrassed to even say it. But guess what? They need cars brought over here, they need the kids watched, they need somebody to grab the dog. And 3 days later, they need lasagna in the freezer. You take it a step further. What if your friend's 21-year-old son is in the ER because of an overdose? You don't get the text then either. Or because they're in withdrawal. All right? They need the cars, they need the kids, they need the dog, they need the lasagna. Okay? And that's turning around the way we think about mental illness, the way we think about addiction. So if you learn how to do this, here's one of the things. When a lot of people come to treatment and I talk about, turn off the gnarly root, stop using the substance, start to build neural pathways. And you know what one of their things is? They literally have grief and loss about giving up their drug. They're sad. I can't imagine never drinking again. Never having a beer. I understand how profoundly interwoven it is with the way they go through their day and their week. I get it. But remember, if you stop the drinking, the dopamine is still there. You lose nothing. I lost nothing. You just have to get much better at manipulating your dopamine. I'm going to tell you a story about dopamine. My brother was going to be here tonight, but he didn't make it. He's sick. This is a story about I said, I'm going to talk about you on stage. My brother's not in recovery. Here's the thing. I ride an old beat-up Harley Davidson. It's 1987 FXRC. That means it's a factory custom. It's beat up. My brother says it's too dirty all the time. I love that motorcycle. I lowered it down so I sit on the asphalt. Okay? But the thing about riding a motorcycle is that when you ride a motorcycle, you don't steer it. You move with your body. You lean. And I like to ride when it's really hot out and really humid because it feels like I'm going through liquid. And the other thing is if you get the cams redone like mine, it's responsive. So if you want to go, you just think go and you go. Okay? So you ride and you go. And you go like this, and I feel like a dolphin in the Gulf Stream. And the best places to ride are river valleys because all the roads go like this. And I don't ride with groups because they want to park their bike outside the bar. That's not me. I ride with my brother. So several years ago, he calls me up. He said, let's go ride. I said, it's supposed to rain all morning tomorrow. He said, let's go tonight. So we get on the bikes, we start riding on Friday night, start going down the river. We stopped at Wabasha, had a steak. That's another way to manipulate your dopamine, by the way. Really nicely marbled steak with char, baked potato, oozing with butter. Get stoned. We get done with the steak. We get down to La Crosse, and it's Irish Fest. We didn't plan ahead. We just got on the bikes and rode. We get down to the La Crosse, and Irish Fest means that the fairgrounds have all these bands, 7 electric fiddles. The ticket takers are gone. We ride the bikes right into the crowd, turn them off, and sit there and watch the stage just go like this for about 20 minutes. And then we realize there's no hotel rooms because it's Irish Fest. So we just ride. And now we're going down south of La Crosse on the Great River Road. And it's in the 80s, in the middle of the night. And it's so humid that there's a sheen and there's a cloud on the river, hugging the river. And the moon is out, and the bluffs are purple, and the water and the steam are silver, and we're the only bikes on the road. And we're just weaving like this. And I hit this moment when I think, this is perfect. I could ride all night. That is what your bucket of dopamine is for. Figure it out. But it's not just that. It's how do you deal with loss? How do you grieve? How do you have a really good cry? That's not dopamine, right, Catherine? It's, what is it when you cry? It's the cortisol. I'm married to a therapist. She helps me out. Won't work for me, though. You learn how to cry. Have you ever noticed when you have a really good, hard cry, you're exhausted afterward, but you just feel this floaty feeling? It's manipulating, okay? You learn how to deal with anxiety, how to turn off your brain. At Programs for Change, we have these strategies. We have these lectures. We teach you how to use the 12 steps to do this. How do you use communication in your interpersonal relationships to do this? How do you figure out family systems and codependency to figure out how to be healthier to do this with your neurotransmitters? That's what treatment is. That's what recovery is. But that's still not what I'm here to talk about tonight. Here's the question. Because what I'm really here to talk about tonight is long-term recovery, because long-term recovery is where it's really at. Long-term recovery. Addicts get a bad rap. In our society, we hear about addiction when people die, and when there's crimes, and when there's accidents. And it's in the news, and it's understandable that it's tragedy. That's not the real story about addiction, though. Did you know that the vast majority of people who have a serious substance use disorder at some point in their life recover? The vast majority. We get the message that if a person is addicted, they struggle, they go to treatment, they relapse, they struggle, they die. Because that's what's in the news. And they are tragic stories. Matthew Perry, Chris Farley, Prince. They overdose, they die, it's huge tragedy. It gives the wrong impression, though. You know what the real story is? Recovery. And beyond that, long-term recovery. Decades of recovery. And what does it take to get to long-term recovery? We know the first step is we admit we were powerless over alcohol, and our lives have become unmanageable. So the first thing you do is you admit, I got a problem. Admit it, I got a problem. It's not character, it's not moral. But the next level is you take it a step further, and that is you accept responsibility for it. Accepting is, and it's mine. My Crohn's disease is mine, and I will deal with it. My diabetes is mine. My addiction, my gnarly root is mine, and that's accepting responsibility. But I take it a step beyond that, because the next level is you embrace it. You know what embrace it means? And I'm better for it. I am better for my addiction. Trust me. Because I learned how to leapfrog in life. Everything that I've ever accomplished, every one that I love, is directly related to my recovery from my addiction. I am grateful. Because if you embrace your recovery, you transcend your addiction. You go beyond it, and you live your best life. So how come we don't hear about that? How come we don't hear so much about recovery? Check this out. We hear about Matthew Perry. We hear about Chris Farley. You hear about Craig Ferguson. He's my favorite alcoholic. I was falling down drunk and pissing my pants. That's my best accent, sorry. I'll do it again if you want. I love Craig Person talking about his bottom. Everything he ever succeeded at came after he quit. You know who you don't hear about so much? David Letterman. I just saw the long white beard David Letterman on the scrolly thing the other day talking about, said, I went to the doctor, he said, I have a distended liver. He said, you're dying of liver disease at 34. He said, I lied to my doctor, said, I don't drink every day. I did drink every day at 34. That was before his TV deal. Never drank again. All of these people are in long-term recovery. Admit, accept, embrace, transcend. Long-term recovery. You know why they don't talk about it, wear it on their sleeve? Because they're beyond it. It's in their past. They don't struggle right now. They're busy living their best life. It's my youngest grandchild. She will learn to listen. But here's the thing. What about the local heroes? What about the local rock stars? What does recovery look like? Looks like Kyle, who started his own nonprofit. He's going to school to become a social worker. Looks like Calvin. Calvin starting his own nonprofit. Calvin going to school. Calvin doing father support groups, working with victim impact panels for years. Okay? What does recovery look like? Looks like Julie up at Onyx, starting all these sober houses. Looks like Brian Bartlett, been sober for years and years, helping hundreds and hundreds of alcoholics. Our other Brian, up at Amory, Programs for Change. Judge Norstrand is here tonight. He's so vocal about his own recovery, he wrote a book. I happen to know if you just talk to him really nice, he'll give you one. You should hear his story. These are the heroes and the rock stars in our own community who are not only in recovery and not only in long-term recovery, but are giving back and helping out. But here's the other thing. It's not just the people who went on into the field to help other people. It's a lot more than that. That we tried to do a great big study in 2015, 10 years ago. How many people are actively involved in their addiction at that moment in time? In the United States of America, they figured it was about 20.8 million people actively involved in their addiction. At that same time, how many people are involved in long-term recovery? 22.3 million. More people in recovery than using. That's not even the best stat. Look at this one. It's not really 75%. It's 74.3%, but I rounded it up. All right? Most people who have a substance use disorder recover. The vast majority. We need to get that message out. Addiction is about recovery, not about dying. And recovery is not just about surviving. It's about living your best life. It's about building all of those neural pathways and getting everything you ever wanted. That's what recovery is about. This is the best one. Percentage of Americans. It's about 1 in 10. That means every time you walk in a grocery store, there's a handful of people in recovery in there with you. Every time you go to church, there's dozens of people in recovery in there with you. Every time you go to a movie. Okay, so you remember that movie back in the 90s, The Sixth Sense? Do you remember what the catchphrase was? I see dead people. I have a sixth sense. I see sober people, and I see them all over the place. And some of my best is I get out of my truck at Quick Trip, and the guy across parking goes, Pete! 4 years, man! I'm like, yeah. I go pay for my meal, and the cashier goes, you're that treatment guy, aren't you? I'm like, yep. Yeah, my boyfriend went through your program. Still sober 5 years. Okay? And it goes on and on and on, and I love that. Okay? I happen to know Some of the leaders in this community are in recovery. I can't tell you. The CEOs, the presidents, the people that run this place. Okay? I turn on the news guy, oh yeah, 15 years. Then they go to weather, they got a special guest, oh yeah, 17 years. Then I'm on Facebook. One of the people, heroin junkie, 24 years ago, he's now doing projects in Dubai and teaching at Harvard. You know who the recovering people are? The people are winning. See, here's the thing. I didn't just get to the cool kids table. We are the cool kids table. That's my message tonight. Recovery not only happens, and when it happens, not only do people survive, but they go on to win their best life. They go on to succeed, have kids, raise their families. There's another guy. Do you know who that is? Maybe you know him this way. Smoking weed. This is Jay of Jay and Silent Bob. Sober 14 years. He just posted this last week. He posted a poem about meeting his younger self and telling his younger self, hang in there. Because when you get sober, all of your dreams will come true. That's the message of recovery. That's what recovery looks like. So there's this other skinny kid. When we talked about, I'm almost done, I promise. I'm almost done. When we talked about having this event, we talked about when to have it. Rob said, oh, what about sometime in March? So how about a Thursday night? How about March 13th? It's like, yeah, that's my sobriety anniversary today. Like I said, what I got from recovery, everything I've ever accomplished, everyone I've ever loved. So I'll say it again. My name's Pete. I'm an alcoholic. Thank you for listening for such a long period of time. I'll leave it right there. This is Lydia from Hazelden, Betty Ford.
Thanks.
You bet.
All right, back to business now. Hi, I'm Lydia, and I am the Director of Operations for Minnesota and Wisconsin Outpatient at Hazelden Betty Ford. And I've been at Hazelden Betty Ford for 13 years, but it's really only been very recently that I've been able to say Wisconsin Outpatient as part of my title. And I say it with a lot of pride because it's been a long road. It's been a labor of love to get here. And I'm really excited to join this community. We are really excited to join this community in meeting our patients at the intersection of substance use disorder and mental health, and trudging the happy road with them and their families. I'm just here to introduce William, and where I come from, he doesn't actually need an introduction, but I'm gonna read what he wrote. I'm just kidding. They're blue light glasses, it's not real. William Moyers is the Vice President of Public Affairs and Community Relations for Hazelden Betty Ford, which is based in Minnesota. Since 1996, I was 9 years old. He's been the organization's public advocate. He carries a message about addiction, treatment, and recovery to audiences everywhere. He's appeared on Larry King Live, Oprah Winfrey, wow. Good Morning America, and National Public Radio. William has written 4 books, including the New York Times bestseller, Broken, My Story of Addiction and Redemption, and his newest book, Broken Open, What Painkillers Taught Me About Life and Recovery, is available now. Please help me welcome Mr. William Moyers.
What did you call it? The gnarly what?
The gnarly rip.
Ripped. Thanks, Lydia. I don't need that. Thanks. I'm good.
Sure.
Yep. You know, when I am introduced by somebody that's younger than I am, which is all the time now, I'm very humbled to see the colleagues that I get to work with at Hazelden Betty Ford. And when I get to come to opportunities like this and plug into something that's larger than Hazelden Betty Ford, which is the partnership, the collaboration that's we're celebrating here in Hudson, it makes me feel grateful for the opportunities that I've had when I have a chance to hear somebody of Pete's, not just expertise, but your passion and your compassion for people in this community. When I get to be part of a celebration like this that includes all of you, I know I'm in the right place. And after 29 years at Hazelden Betty Ford, I'm getting ready to retire. That's hard to believe. But I know as I get ready to move on that the field of addiction treatment and recovery, emphasis on recovery, is in good hands with people like Lydia and John Ingebreath. Where is John? Is he? Oh, there you are, John. John Ingebreath, who runs. You're in charge of this with Lydia, right? And our outpatient services in the Twin Cities. Rob Devereaux, where's Rob? My colleague Rob, who helped to put this on. Arch Rannon, Arch. Danny Jordan, where's Dan? There's Danny. I knew I was going to forget a couple of people, but I wrote them down. And Susan Witten, where's Susan? Where's Susan? She's around. She's probably out at the booth. Susan and Karen Elsey. Karen and Rob. Did I mention you, Rob, already? Rob Devereaux, yeah, I did. And then my two colleagues in philanthropy, and I'll come back to that in a minute. Mark Turback, Mark, Gene Vukas-Roberts. Where's Gene? You know, philanthropy has played a big role in what's about to happen here, or what's happening here. If it wasn't for the generosity of the donors to these organizations, particularly Hazelden Betty Ford, and to the communities, we wouldn't be able to do this. And so philanthropy, you can't have a margin if you don't have a mission, as we all know in the not-for-profit world. And a big part of the mission at Hazelden Betty Ford is philanthropy. And so whether it's our philanthropists, our marketers, our outreach, or our clinical staff, it's very reassuring to me to know that this field of addiction treatment and the communities of recovery are in good hands, even though I'm getting ready to move on. It really is reassuring. And to be able to come to a community like Hudson, I live in St. Paul. I've got a cabin up between Siren and Spooner, so I love western Wisconsin. But to be able to come to a community like this and to see, as Pete was talking about, how much evolution there's been, where we used to gather to talk about the problem in Hudson. And we used to gather to talk about the problem in St. Paul, and we used to gather to talk about the problem in New York City and in Los Angeles and all those other places. But now we come together to talk about the solution. And the fact that you all have taken time out of your busy lives on a beautiful evening in Minnesota and Wisconsin really says a lot, not just about your concerns around the problem, but about the reality that you know, which is called recovery. So thank you all for being here this evening. You already talked about the parts that I don't need to talk about, Pete, and that's unusual for me because I do give a lot of talks around the country. Last week I was in Washington, D.C. to talk to rural healthcare providers. Very difficult time to be a rural healthcare provider in this country. Very difficult time. I was in West Palm Beach the week before that. I was in Arizona the week before that. And I get around. But to have you, to follow you to the stage, Pete, what you've been doing here in this community for so long, and to be able to follow to the stage somebody who not just is a top clinician in this community, but somebody who has the power to communicate these things in a way that resonates. Thanks for doing what you're doing, because I don't have to do it. There is one part that Pete didn't talk about, which is what I want to share with you, and it's the only thing I'm going to be up here to share with you this evening, and it's really to talk about the family component of addiction and to talk about the family component of recovery. Because, you know, when we deal with addiction, substance use disorder, mental health problems, we're always focused on the patient or the person who has the problem. That person gets a lot of attention, and of course that person gets a lot of attention. They're sick, and they need to get well. And getting well oftentimes means treatment. But we don't pay as much attention, perhaps, as we should, at least not initially, to the family. And we know that addiction and mental illness are conditions that affect much more than just the person who has it. It affects the entire family. And with the opioid epidemic being what it is in Hudson and in the Twin Cities and across this country, we sadly know that a lot of people who struggle with addiction don't make it. But that doesn't mean their families shouldn't make it. And it's really important, particularly if you are a family member, perhaps you're struggling with somebody in your family who has a substance use disorder or a mental illness, and they don't want to get well, or they haven't been able to get well yet. Or perhaps you're from a family that's lost a loved one to suicide or to a substance use disorder. Sad as it is, you have every right and you have every need to recover as well. And I want to emphasize that to you tonight by just sharing briefly, before we take a little bit of Q&A, my perspective on the family dynamic by sharing a little bit about my family with you. But before I do that, let me just ask, and I don't want to put anybody on the spot, but I'm going to ask it anyway, so if I ask it and you don't want to answer, that's fine. But are there people here tonight who are family members of somebody who struggles with a substance use disorder or wow. Wow. Okay, so I'm talking to you, but I'm talking to everybody else as well. And thank you for disclosing that. So I'd like to talk to you about the family from my perspective and the experience of my own family. I have 3 children. Actually, I have 4. One is a stepson. I don't like to call him my stepson, but the son of my wife, Nell Hurley, who some of you know. So I have 4 children. But for a long time, I had 3 before Nell and I got together 15 years ago. And my 3 children grew up, unlike me, my 3 children grew up fully understanding what addiction was. In my generation, when in the 1960s, I'm almost 66 years old now, we didn't talk about addiction in my family. We talked about the war in Vietnam, the Beatles and the Rolling Stones, the birds and the bees, Watergate, long gas lines. We talked about the current events of the time, but we never talked about probably the one thing we should have talked about, which was addiction in our family. We did not talk about it, in part because my parents didn't think they needed to. By the way, I'll leave it at that. So we talked about everything except that. Well, when my children were around the dinner table in the 1990s in St. Paul and into the 2000s, we talked about addiction all the time because we had to. That's because my children are the product of 2 alcoholic and drug-addicted parents, me and their mother. My 3 children, from the time they were 5 or 6 or 7 or 8 years old, knew that mom and dad had met as a result of coming to Minnesota for treatment in 1989. So Henry, Thomas, and Nancy knew all about where mom and dad met, which was through the recovery process in St. Paul. My 3 children knew my using story, and I don't share my using story tonight because my story is Pete's stories, and Pete's stories is your story, and your story, and your story. We're all the same. We developed that baffling inability to just say no. I've got a vulnerable brain. I got a hole in the soul. I got a lot of dynamics, as Pete talked about, that feed into this thing called addiction. And so my children know my using story, that I smoked marijuana at the age of 15, and 15 years later, I was living and dying in a crack house in Harlem, New York. That's when I came to treatment at Hazelden in 1989. So my children know they're the product of 2 alcoholic parents. My children know their mother and their father's using story. But my children also know that their mom and dad are recovering alcoholics, because that's what we are. Their mother and I are not together anymore, but nevertheless, we're recovering alcoholics. So my children not only knew the problem, they not only knew their parents using stories, but they also know the fact that their parents got well because they got treatment. In my case, I needed 4 treatments over 5 years between 1989 and 1994 before I learned to take personal responsibility for managing my chronic illness, and I got better. So my children knew that they're vulnerable. My children knew their parents met through recovery. My children knew their parents' using story. My children knew what it means to recover, because we used to take them to recovery meetings. It's a great place to take young kids. For that hour, it's free babysitting. But we took them to because we wanted to expose them to that truth, not just the problem, but the solution. My children also know that for the past 29 years, their fathers worked at Hazelden, now called Hazelden Betty Ford. We merged with the Betty Ford Center in Rancho Mirage 10 years ago. So my children knew the entire continuum of the genetic predisposition, the vulnerability, the baffling inability to just say no, the fact that substances can be addictive, the fact that treatment can work, the fact that recovery is possible. My children knew it all because we had to tell them. We had no choice. By the way, we also told our children that because they were the product of 2 alcoholic parents, they were 4 to 10 to 15 times more vulnerable to substances than their using buddies or their classmates at school in St. Paul. Because why? The genetic predisposition. And when you are the product of 2 alcoholic parents in the family, you're at a really high risk. So I share this with you, particularly aimed at families, because it's okay to talk about these things. It's okay to talk about these things. And since you're here tonight, you've come here because you care about this issue. So it's really okay to talk about it with your children or your grandchildren, or, as Pete encourages us, with others. But my point tonight is it's okay to share our stories with our children. We always told my children growing up, kids, if you choose to use, you may not be able to choose the outcome. We weren't trying to scare them. You know, Nancy Reagan coined that phrase, just say no, in 1980. We know how well that works. There's nothing wrong with sharing that, but if we think that just saying no is going to shield the next generation from substances, well, it doesn't work that way. So we said to our kids, if you choose to use, you may not be able to choose the outcome. You have a vulnerable brain. You are the product of 2 alcoholic parents in recovery, but nevertheless. We also said to our children, we don't want you to use substances until you're 21 years old. Now, why would we tell our children not to use substances until they're 21 years old? Well, because that's the law. It wasn't necessarily in some of our older generations. I mean, the drinking age when I was 18 was 18. But the drinking age is 21 now. So, like it or not, that's the rules. That's the law. And we don't want to encourage our children to break the law any more than we want to encourage our children to text while they're driving on Interstate 35. Or we want to make sure we encourage our kids to use their seatbelts. Because not only because it's a good thing to do for safety reasons, but it's the law. So Henry, Thomas, and Nancy, we don't want you to use until you're 21 because, first of all, that's the law. But secondly, we don't want you to use because you're vulnerable and you're also young. And we know what about the brain? It is the last organ in the body to develop. And what happens in the brain? It's where decisions are made and risks are weighed. And when you do this, or you do this, or you do this, it goes there. And it compromises the ability of a young person or anybody for that matter, but particularly a young person whose organ is not yet developed, it compromises their ability to make the right choices. So Henry, Thomas, and Nancy, don't use because it's against the law. And Henry, Thomas, and Nancy, don't use because we want this organ to develop as fully as possible up to the age of 21. But I'm no dummy, and their mother is no dummy. We knew that even though we had talked to our kids around the table, we had modeled what it means to be people and parents in recovery. Oh, by the way, we don't serve alcohol in our home. And it was a great point you made. We're not intolerant of alcohol. There's nothing wrong with responsible drinking. There's also nothing wrong with responsible drug use if the drug is legal, as it is marijuana. And is marijuana legal in Wisconsin? So there's nothing wrong with the responsible use of marijuana in Minnesota, because it's legal. But we modeled responsible behavior in our home. We never served alcohol because we don't drink it any more than we serve cigarettes because we don't smoke them. So our kids were able to see that you could have a good time at Christmas or at graduation or at a birthday without getting lit. So we modeled that, we talked about that, we encouraged them, we set the expectation, we don't want you to use till you're 21. But being sensible parents, we also knew that it was likely that might not work. So I thought I would do one more thing. I thought I would incentivize my 3 children not to use. Yeah, Mark, yeah. I told my 3 kids, Henry, Thomas, and Nancy, if you wait until you're 21, I'll buy you a new car. Pretty good incentive, right? Well, I didn't have to buy a new car for any of my kids. Wow. Think about that. My children had never seen their parents drink or take drugs. My children knew their parents' history. My children knew that you could grow up and have fun without drinking or drugging, and they still experimented. About 10 years ago, my middle son, Thomas, came home from his freshman year at college in Vermont, and he said, Dad, I've stopped drinking, but I can't stop smoking weed. In that moment, when Thomas told me that, it woke me up to the greatest gift I've given my 3 children, and something I want to give you all tonight as part of this collaborative community effort to bring wellness to Hudson and the St. Croix Valley. When we raised our 3 children, we also told them that it was okay for them to come to us and ask for help. How many of you were offered that option by your own parents when you were younger? You were. You're fortunate, and you were. But not many of us. You know, by the way, I have 2 parents who are still living. My father's 91, my mother's 90. They've been married for 70 years. I don't come from a broken home. I come from a very engaged family, right? And yet they never gave me that option. It's okay to ask for help. So when Thomas came home from college, he said, Dad, I've stopped drinking, but I can't stop smoking weed. Dad, I need help. It worked. I gave him that tool in that toolbox, which was it's okay to ask for help. Thomas was assessed as being dependent on substances. He was assessed as being dependent on substances by the world-renowned Hazelden Foundation, which means what? Well, we're an abstinence-based program, so when we assess you as being dependent on substances, that probably means you should stop using them, right? Well, it's been 12 years ago, now 10, 12 years ago, and Thomas still uses. But he uses vastly different. He has 1 beer. He never is intoxicated. He has recovered from the desperate condition that caused him to come to me with my permission and ask for help. Yes. A few years after Thomas came to me and asked for help, my daughter Nancy, who was a senior in high school, came to me and she said, Dad, I've been drinking to blackout since I was 15. I said, what do you mean you've been drinking to blackout since you were 15? You've been living upstairs on the 3rd floor of the house. I didn't see it. Me, the recovering alcoholic who works at Hazelden Betty Ford, I didn't see it. Dad, I've been drinking to blackout since I was 15. I need help. 2 for 2. It worked. We had Nancy assessed. She was assessed as being dependent. It's been 7 years, and she hasn't had a drink or a drug in 7 years. She's a therapist. She graduated from Columbia with her LMSW, and she's a therapist in New York City. In fact, I'll see her tomorrow night when I'm there. But Nancy doesn't recover the way I recover. She doesn't recover the way her brother recovers. She chooses to recover the way that works for her. 2 for 2. Lastly, my oldest son, Henry, who is both blessed and cursed to be just like me. 5 years ago, while a freshman at Mitchell Hamlin Law School, he came through the front door one day with tears in his eyes, and he said, Dad, I don't know. When I drink, I binge drink, and I can't stop. I don't know what to do. I need help. 3 for 3. I need help. All 3 of my children came to me and asked for help. Why? Because I gave them permission. Because we had talked about it. Because that shame that Pete talked about as it relates to a dependency on substances is so toxic, that shame, that it can cause children not to come to their parents and ask for help, or cause those of us who suffer in the streets not to ask for help. But in this case, because I'd given my children permission, Henry, Thomas, and Nancy all came to me and asked for help. By the way, when Henry came to me and asked for help, I gave him some suggestions on what he might do, and he continued to drink. But 15 months ago, or 13 months ago, 14 months ago, Henry decided that his way wasn't working. That is, the way that his dad had prescribed was not what he wanted, so he tried something called dry January. And it worked. Henry, he's on his path of recovery. It's different than mine, but I have to respect that because I love him. Nancy, she's on her path of recovery, which includes abstinence. It's been 7 years. She does not recover my way, but she recovers. And Thomas, it's been 10 years. He still drinks. He drinks differently. And in a couple of weeks, he's going to make me a grandfather for the first time. Point being, all the things that we do as parents and as grandparents, as siblings, as aunts and uncles, all the things we're doing in this community by having an open conversation. This is rather extraordinary to have this kind of event in a public auditorium like this. All the things that we do are important when it comes to this illness, and as Pete so aptly emphasized, the solution to this illness. And I hope for you all, and we hope that at Hazelden Betty Ford, and with this collaboration that we're doing here in the St. Croix Valley, we hope that you will take some of what you've gleaned from this opportunity tonight and take it back into the community, however you choose to define community. But most of all, we hope that you as concerned citizens and as family members will take some of what you've learned here and go back to your families and share that, with a really important message to our next generation, or our next generation of children, which is, it is okay to ask for help. What a gift we can give to that next generation. And as I've so painfully learned, which is why I call myself a double winner, I also have to respect that my children are going to recover the way they choose to recover, and it might not necessarily be the way that I would like or that I recover. But you know what? As long as it's recovery that includes dignity and respect, I'm okay with it. And so I want to close by just telling you all inviting you all to take back something from what Pete talked about, something from what Brian or Lydia or whomever it was you might have heard from, maybe something that I've heard. Take it back to your community of influence around the dinner table, at your church, your running club, the hospital, the bar. Take it back and share something that you've learned tonight in a way that empowers people to know that it's okay to ask for help, whether it's your children, your grandchildren, your siblings, your colleagues, a stranger at the gas station. It's okay to ask for help. Why? Because addiction is an illness. It's treatable. Recovery is real, and it's happening here in the St. Croix Valley. Pete, thank you very much, and thank you all too.
Ladies and gentlemen, we have a few minutes. If anybody has any questions for the panel and our presenters, please don't be shy.
Come on.
Pete, that map that you put up there of the United States,
Yep.
Wisconsin is deep purple.
Yep.
Where'd you get that? What's the source on that? I'm just curious. I don't doubt it one bit.
I've got
I come from those deep purple counties.
that particular map is dated 2019, and it is a part of, like I said, the public health departments in each state measure county by county those measures, excessive drinking, which is binge drinking and heavy drinking, and they're defined. So you go to it would be at the United States where they control that data. You can go to SAMHSA, or you can go to the CDC, and you can find that map.
I really like your whole spiel. Thank you for coming and doing this. My question, Peg, is so when the whole thing about 75% of people recovering.
Yeah.
I've never heard that before. It's great news, right?
Yeah.
I always hear about low numbers, people not low percentage rates of success and all this stuff. And,
Right.
AA is the best that you can get, and it might only be 15%, or stuff like that. A little bit pessimistic kind of stuff. I love this optimism. So where is that coming from?
Yeah, again, I was real careful that's why I put 9%, not 10. That's why I quoted 74.3. But those are public health measures. And by the way, that particular 75% of people recover, okay? That is people who have a significant substance use disorder at some point in their life. That means diagnosable. They could be diagnosed as having a substance use disorder at some point in their life. And recover is a wide spectrum.
Right. Yeah.
So it's not that they're all completely abstinent forever, but that they've recovered from that, so they're no longer diagnosable. All right? And if you do the Google search, you can find them, and they are, again, SAMHSA, which is the national database for this kind of research, has those numbers.
I want to add something to that too, which is Pete just mentioned it here, and then Lydia, I have a question for you, so just so get ready. I mean, as I shared with you, my three children are recovering. They're just recovering differently, and one of them continues to use, but they've recovered from the desperate condition that caused them to come and ask for help. Many years ago, I was really fascinated by this statistic that hit me, which was, I think Pete used it tonight, that 9 or 10% of the population is recovering. And that's, 20 or 30 million people, right? 20 or 30 million of us are recovering. But if you go to the world headquarters of Alcoholics Anonymous in New York City and ask them how many active members they have, they'll tell you they got 2 or 3 million. So where is everybody else? And I think that's the point. They're recovering from what their problem was. They may not be recovering the way that Pete recovers or I recover or other people, but they're recovering in their own way. Some recover in church. Some recover in yoga. Some recover in 12 steps or life all those other recovery programs. I think the key is not to assume that they're all recovering in a 12-step group, which is an important, way to find recovery, but they're recovering from what caused them the problem and what got them to change their using. Does that help? Yeah.
Yeah, and I just wanted to add, when I put up on the screen the list of the famous people who are in recovery, and I put those years up there, I researched every single one of them. Be careful here. But the reason I put those up there is because they are professing that they don't drink at all.
Right.
Okay?
Right.
So abstinence is, and I explained why I suggest that for people who have crossed those thresholds into compulsion. Not everybody crosses into compulsion. Some people have a drinking problem and doesn't cross into compulsion. But if you do, that neurocircuitry is there. And I'll just add this. If you learn to play guitar really, really, really well, and you line up all of your muscle memory and your ability to be expressive musically, and you become a lead guitarist and you do that, and then somebody breaks your heart and you burn your guitar, and you don't pick up a guitar for 15 years. Okay? But then you have a kid and you want to play lullabies, so you pick up another guitar and you go back to playing guitar. You don't have to start over from scratch.
Right.
Because the neural pathways are still there.
Yeah.
And that's when I talk about the gnarly root. If you've reinforced it that strong, you may not pick up for 20 years. But the neural pathways are still there, dormant. They can't harm you if you don't drink or use. So that's my model about people who've crossed over into compulsion.
Yeah. I want to ask Lydia a question because I think it really speaks to what is about to happen here in the St. Croix Valley when we open this new collaborative opportunity. And Lydia, that's around the recognition that most people who show up for treatment these days don't just struggle with a substance use disorder. They have a mental health condition. I know, Pete, you've experienced that over all your years, but it seems like now more than ever, there's an awareness about that. So Lydia, can you speak to the co-occurring disorder aspect of the illness and what we're going to do here in the St. Croix Valley?
Yeah.
Got to get to the mic, though.
Oh, I could be loud.
I know you
I'll
can be
speak
loud.
into the
Believe me,
mic
I know that.
Instead. It kind of feels like it goes without saying, right? The substance use disorder and co-occurring mental health conditions. But for as long as we've known deep in our, heart and our gut and our experience that the two go hand in hand, more often than not, it's taken a while for treatment approaches to catch up to that. What we will be offering in our Hudson clinic is truly integrated, evidence-based care for both co-occurring mental health conditions and substance use disorders, meaning that both needs will be addressed through the programming that our patients are engaged in. We will be addressing both, and the programming will be facilitated by people who are licensed in both substance use disorder treatment and mental health treatment. It's an amazing thing to see it happen, to watch it be built, and we've implemented this program at our St. Paul site, and this is something that we'll be implementing here. It's really amazing to see the feedback of the patients and their families who are engaging in this specific program, how many treatments they've been through and never quite felt like it was doing the trick, never quite felt like it was addressing everything, and all of a sudden feeling like they actually got what they've been looking for. It's a really amazing thing, and through a continuous improvement model, we continue to make it better and better based on the feedback of those patients, and we'll do so in Hudson as well. It's really exciting.
Pete, what's been the biggest change? You've been a counselor for how long, or you've been in the field for how long?
40 years.
What's been the biggest change since you first came into the field?
Treatment was different in the 70s. The Hazelden people are laughing. There's a lot of yelling going on.
Yes.
In counter groups.
Yes.
Really what we're talking about, which is integrating into healthcare.
Yes.
So addiction is a mental health condition. It's a physiological condition. It's a health problem. and so you treat it like you do other health care. So integrating recovery from addiction into overall health care. And we do that. All of our programs are integrated with the different behavioral health services, therapy, psychiatry. We have an inpatient psychiatric unit, all kinds of things. And so integrating your recovery from addiction into healthcare. And by the way, there's some HealthPartners big shots in the room. I just want to say this. I've had the luxury working with HealthPartners to develop a lot of programs in the Valley. Hudson, Westfields, Amory, Lakeview, develop therapy counseling, integrated behavioral health consultants, all that stuff, because HealthPartners has made a commitment to it, and it doesn't make money. I'm sorry, I'm just going to tell them, all right, Tom? It doesn't make money, and HealthPartners invested in it anyways. And you know who are my favorite people to talk to are the board of directors of these hospitals, because they want it. They'll go to the CEOs and say, yeah, surgery, okay, birth, okay, yeah, but what about mental health? What are we doing again? And they want it. And the foundations, we've got the foundation president sitting right over here. Foundations want to spend money to address this. But the change over the years is this is diagnosable, the prognosis is clear, it's treatable, and it's successful, especially when you integrate it into overall health care.
Another big change is that insurance covers addiction and mental health treatment. And some of you may assume that to be true because you're newer in the field or newer in the community, but when I was a patient at Hazelden in 1989, about 5% of our patients were able to use their insurance to access our system of care. And today, John, what is it? 97, 98%. And I guess that's true also at the providers here in the Valley, right? I mean, you can use your insurance for addiction and mental health treatment like you can for diabetes, hypertension, HIV, AIDS, and all those other chronic illnesses. Finally.
Not only that, but because we're part of a hospital system, we're able to bill to Medicare and Medicaid and TRICARE for veterans as well. So public insurance covers our treatment services also.
Great point. Other questions, comments? Hold on. You're gonna go first since you raised your hand, and then we'll get you back there. Go ahead.
I was just going to ask if you have your books available to purchase here tonight.
Oh, no, I don't have any books to purchase, but I'm easy to find. So you can email me and well, never mind. I was going to say I send you one, but I have to send one to everybody. So we'll talk after. Thank you, though. Yes?
As a family that's been in recovery now for a while, we travel quite a bit across the country, and what we noticed after the recovery started, when we went to Tennessee and we went to other states, and you look at the TV, you never see alcohol commercials, right? In Wisconsin, what do you see? It's all winter long. You're not having fun if you're not drinking at a barbecue, drinking during a game. You're not going to have friends. You're not going to have any of these things if you don't drink. You're not manly enough if you don't drink, whatever. Do you know any efforts in the state anyway to change?
Oh my God.
How much time do we have?
Yeah, right.
Yeah, this is a pet topic of mine. I'm not going to go into it. I can't. You guys have been sitting here a long time. But here's the thing. Wisconsin's different than every other state in the country in the way they pass laws about drinking and liquor licenses, advertising, all of that stuff. One state does it this way, and that is by municipality. There's over 1,500 municipalities in the state of Wisconsin. You can't pass a state law that covers the state about drinking. Ha. And so there's lots of answers to that question. But you're right. People come from a different part of the country, they drive through here.
I'm a casual drinker, but
Yeah.
but my husband is not. He's been in recovery for 15
Yeah.
years, so it's amazing. But just that when we talk about our kids,
Yep.
it's just a continual messaging that you are not.
Yeah, so it has an impact. But again, the main issue is what impact does it have on excessive drinking? Right? And so, yes, it does. To our children, the fact that you can walk in to a gas station, I mean, people are blown away in Wisconsin. You walk into a gas station, and not only are they advertising alcohol, they're selling it in the gas station, and they have a car made out of cases of Budweiser for the kids to crawl on. Okay? And the little bottles are at, man, when I was a kid, I'd be grabbing those, okay? I mean, there's all kinds of answers to that question about, but again, be clear. It's about excessive use and about dependency that makes a difference.
Yeah.
But those things do impact.
But I mean, I think it
Yep.
adds to people going, well, you know, I'm just having fun, right?
Yep.
And as long as if I drink, then I can become more fun, and the person that people want to be around, quote unquote, because that's the messaging that we get, you know, from the time. In Wisconsin, I think is the only state that you can bring your kid in
Yep.
and have a drink with you,
Right.
and it's not a sure reception. I mean, it's
Yeah.
it's an outright drink.
Stay in touch with me.
Yeah.
I know who you are. Stay in touch with me, because I'm going to be retiring too. I'm going to keep lecturing, but I'm going to retire too, and I'll be involved in things like that.
Brian, I have a question for you real quick before we wrap it up. I know Robert got to wrap it up soon, but why do you think doctors don't know about, as much about addiction as we assume they do or they should?
There's lots of answers to that question. Part of it is our field's fault. For the long time, substance use counselors, we said we're different. We understand addiction. We don't want anything to do with you, right? You go to your doctor, we'll deal with addiction. Neither shall the twain pass. And then I got into doing what we do, and we're a part of HealthPartners' psychiatric residency training program, and I come to learn that psychiatrists get 1 month of addiction treatment training. These are the mental health experts, and they get 1 month. And I'm not an expert on why that is, but it's their training. And for doctors who have been in the field for a very long time, and there's only one doctor, so I hope I'm not offending her. It may not even have been that. 1 month, right? Yeah.
Yeah.
And like every other one of us, they have hobbies and kids and all kinds of things, and it can be very hard to push ourselves to learn new things. And it's a terrible shame because we live in Wisconsin. Can I share my favorite Wisconsin drinking story with y'all real quick? You all have heard of the Wisconsin University Badgers? Yeah. So a couple years ago, they played a football game at BYU, Brigham Young, in Provo, Utah. And if you know anything about Utah, it's got quite the population of Mormons. And alcohol use is against the tenets of the Mormon faith. And their laws reflect that. And so Provo, Utah, which is home of Brigham Young, the flagship university of the Mormon faith, has like 4 bars. For perspective's sake, my town has 1,300 people, and there's 4 bars. And 2 more within a mile of the city limits, right? 2 more? Yeah. Kayla lives in my town.
Wow.
When the Wisconsin Badgers came to Provo, and they brought all their fans with them, they drank Provo dry. There was no more alcohol to be had sold commercially in Provo. And that is emblematic of what you were talking about, and and we see that with the medical providers as well. Pete talked about stigma, you talked about shame. We see it in our own providers. They don't want to talk about their drinking because it's hard to think about their own drinking or their own drug use or their kids or their dads or their wives. It's all wrapped up together, unfortunately.
Yeah. That's why we hope that you will take something that you gleaned from this remarkable opportunity this evening, take it out of here and take it back to where it matters in your family and in your community, and share that with somebody who was not here tonight. Also, I think you would agree, Pete, if you're somebody who is struggling with a substance use disorder or a mental health condition or a family member, it's okay to ask for help, and you know where that help is. And lastly, Rob, if I can put you on the spot just to come up and just tell us when the ribbon will be cut on the new site.
Sure thing, and then I'll let y'all go. So first off, thank you for being here. It's next Thursday. We're right across the street from the Taco John's. Carmichael, there's a flyer outside if you like. So we're doing a ribbon cutting next week. We'll actually start scheduling folks the end of the month on the 31st, and we will open on April 14th. So we're going to conclude for the evening. I will say thank you so much for being here. We all know, and I hope you guys know. If you have any other questions, I know the presenters may stay around here for a second so we can chat. As a person in long-term recovery, that if recovery wasn't better than drinking, we all promise you we'd be drinking and doing other things. So this is the best thing that's ever happened to us. Thanks for coming.